Tonight's big question, should healthcare workers be forced to take the H1N1 vaccine? That's what New York State is requiring, and today a nurse, Sue Field, went to court so that she and other healthcare workers won't be forced to get the shot. A judge has denied her request.
I have an issue with the government mandating me to get these vaccines and telling me that if I don't comply, then I don't have a job. Seasonal flu and H1N1 this year, what will the government then have the right to say they want to inject us with next year?
The big question tonight are healthcare workers who refuse to get the swine flu shot putting the rest of us at risk. And joining me right now is Patty, who is Sue Field's attorney. Appreciate you being here with us. We just heard why she filed this suit, but New York State has said that when they allow this to be voluntary, on average, only about 40% of healthcare workers end up getting flu shots. And you got to know what the concern is that they're around patients who are sick or whose immune systems are compromised. So if they have swine flu or, don't know they have swine flu, they could end up really making someone sick, much, much sicker. So what's the response to that?
Well, we're not necessarily disputing the need for vaccines or even the efficacy or safety of this shot, although there is serious questions about H1N1 in particular because it's been rushed to the market. The real basis of this lawsuit is, does the Commissioner of Health of the state of New York have the authority to mandate compulsory vaccinations for New York State healthcare workers?
I get all that, but you heard my question here. I mean, you could be endangering sick people if a healthcare worker hasn't been vaccinated. So how do you respond to that?
Well, I mean, the disease can be transmitted by anyone to anyone. I mean, a ride on the New York City subway.
Right, but we're talking about sick people in a hospital. They're not riding on New York City subways. They're being cared for by healthcare workers with the assumption that the people caring for them are well. So how, I don't know how you deal with that by any other means and then having, then making sure that these people have been vaccinated.
Well, I mean, the presumption is that these healthcare workers are experienced in dealing with universal healthcare precautions and disease control. And they
I know, but how do you deal with having swine flu?
Well, first of all, the problem is not at the magnitude that it's claimed to be. I mean, there's 19 million people in the state of New York and only 167 or so cases of the disease reported.
Right,
I mean,
but we haven't even entered flu season yet. I mean, that's what they're all saying, is that this is going to get much, much worse. As the season progresses. But let me bring Sanjay, our own Sanjay Gupta, into this. Sanjay, what do you think? I mean, should this be mandatory for healthcare workers? You're going to have to get the shot if it is.
Yeah, it's interesting. I had the virus, so I'm actually protected.
Oh, actually,
it's a tough
that's
way to
true.
get protected.
How could I have forgotten?
Right. But I think that it's a very good point. You're asking good questions. I mean, I think that you put your patients at a real risk here, and I think you can sort of be wishy-washy and say, well, is it going to be a big deal? People are concerned about the safety of this vaccine, but you're absolutely right. In our hospital and a lot of hospitals around the country, not at the state level, not at the federal level, but at the hospital level, we're getting the message down pretty clearly. You got to get vaccinated.
Patty,
and it makes a lot of sense.
Yeah, Pat, very quickly, are there certain steps your client is willing to take that she believes are going to be enough to ensure that she couldn't or wouldn't be able to infect her patients?
Well, first of all, my client experienced a reaction to a previous flu vaccine, and as a result of that, she does not want to get further vaccinations, but yet she does not have the documentation required to get a medical exemption. There are very narrow limitations or exemptions.
So again, you heard my question. Is she going to do something that she thinks in some way can ensure that she will protect her patients from getting anything if she has it?
Well, she does every day. I mean, hand washing, respiratory masks. If you're ill, hospital employers should allow the nurses to stay home. There are alternatives to the vaccinations, particularly for someone who cannot receive the vaccine. I mean, people have objections to vaccines.
So presumably you're appealing this decision, I guess? Or?
No. Well, all that happened today was that the judge just denied a restraining order, which was actually somewhat expected. It was extraordinary relief. But this is an extraordinary problem. I mean, we're back in court on Thursday at 10 o'clock, and the judge will hear the matter further on a preliminary injunction.
All right. We got to end it there. Many thanks. Appreciate your time, though. And Sanjay, as always, thanks.
Thank you.
I need to check on the blood work and see Katie before she goes home.
With integrated healthcare,
has issued a temporary restraining order preventing mandatory H1N1 vaccines for healthcare workers. The state's second largest public employee union sued to block the mandatory vaccinations. The Public Employees Federation says it encourages members to be vaccinated, but opposes the emergency regulation requirement. The restraint is pending a hearing that will be held October 30th. The State Health Department maintains the Health Commissioner and State Hospital Review and Planning Council have legal authority for the mandatory regulation.
I know it's not over.
For healthcare workers like Mary Cookman,
If you are opposed to these vaccines, this is all that's on your mind.
Friday's ruling delaying state-mandated flu shots is cause for celebration.
I was just ecstatic.
Mary works in the billing department at Highland Hospital, says she has no contact with patients.
I'm very happy there, and there was no way I was thinking of leaving.
After learning she could lose her job if she refused the H1N1 vaccine, Mary took her case to court, joining a federal lawsuit challenging the state mandate.
It should be a free choice.
The New York Civil Liberties Union agrees and says this mandate is a violation of civil rights.
And this was a case where, again, where there was a regulation that was taking that basic right away from somebody. So this really needed to be challenged.
Local hospitals like Strong Memorial are still awaiting clarification from the state on how they should proceed following this ruling. In the meantime, the H1N1 and seasonal vaccine will be made available to healthcare workers and staff on a voluntary basis.
We have vaccines that are effective, that are safe.
The Monroe County Medical Society says if healthcare workers aren't vaccinated, the public will be put at risk.
You shed virus before you get symptoms. So even if a healthcare worker were to commit to staying home when they were sick, that's not enough protection.
With more court dates ahead, both sides know this fight is far from over.
Long road yet to go.
For Mary, it's a fight she now believes she can win.
Seeing a little bit of light makes me feel good.
Casey Bortnick, YNN.
The lawyer representing Cookman and 5 others in federal court is now seeking an injunction to stop the nationwide distribution of the H1N1 vaccine. No court date has been set to hear this motion.
In New York, you won't be required to get the H1N1 vaccine. After all, the state is temporarily backing away from making H1N1 vaccines mandatory. Our Curtis Schick is in the newsroom now with more. But Curtis, the thing that's been getting all the headlines, the pressure from the healthcare community, that's not the reason for this turnaround, is it?
No, it's not, Kate. The state health commissioner, Richard Daines, says the big reason is that manufacturers haven't been able to make vaccines fast enough. Now, Daines says only a little less than a quarter of the doses New York requested have arrived. The state only received a little more than 1.5 million of the 7.2 million it is slated to get. Earlier in the day, Daines acknowledged the shortages but was confident New York would have enough. But now, H1N1 vaccines will be limited to pregnant women and people under the age of 24, along with people at risk for serious illness or death. And this means mandatory vaccination for healthcare workers is on hold.
But it just hasn't come off the production lines as fast as they anticipated. And since our mandate was it required immunization of healthcare workers by November 30th, we really couldn't mandate that without setting up a competition between healthcare workers and the very patients that they're there to serve.
And to just give you an idea of the demand, Daines says that in the first 2 days H1N1 vaccine was made available, the state had about 1.4 million orders and was only able to provide 140,000 doses. Kate?
Now, Curtis, did Daines mention at all that with this being on hold, is there a chance that once the supply catches up, is the mandate going to go back into effect?
Well, he left that very open-ended. This mandate hasn't been canceled. He made it a point of saying that this is a temporary order, that it could come back into effect. So right now, it is just, like I said, temporary.
All right, thank you. Curtis Schick reporting for us in the newsroom tonight.